Hello, my name is Thomas Raglow, and today I'll be talking to you guys about the disease tetanus. So the infectious agent that causes tetanus is the bacteria known as Clostridium tetani. It's a gram-positive bacilli, an obligate anaerobe, meaning it can't survive in the presence of oxygen. It's also very sensitive to heat. However, it does form endospores. These endospores are very resistant to heat. They can survive autoclaving and other chemical agents. And these endospores are very important when we look at how a person gets infected with Clostridium tetani. And we'll get into that in a little bit. It's one of 4 common pathogenic species in the Clostridia genus. Other notable species include Clostridium botulinum, that causes botulism, Clostridium difficile, that causes diarrhea and colitis, and Clostridium perfringens, that causes food poisoning. So here you can see an image of Clostridium tetani. You can see that rod shape. They do look like a drum because it has that spore-forming end, and there's that endospore in the middle. And here's a picture of the colony morphology of Clostridium tetani. So how does a person get infected with Clostridium tetani? So it's not going to be from human carriers, and that's because it's an obligate anaerobe, meaning it can only survive in anaerobic conditions. However, their endospores can survive. They are found throughout the environment, typically in stuff like soil, dirt, feces, manure, stuff like that. And these spores are typically going to enter the body through cuts, through breaks in the skin. Typically, people say if you step on a rusty nail or you get cut by something rusty, you should go get a tetanus shot. And while that's true, it's not the rust that's causing the tetanus infection. It's that those bacteria spores, they can be found anywhere, not just on a rusty surface, but most primarily in stuff like soil, dirt, feces. So getting a cut and having it be contaminated with stuff like that, that's what's going to get you infected with Clostridium tetani. Especially these deep puncture wounds, those are also high risk for tetanus infection or Clostridium tetani infection. And stuff like burns and crush injuries are also high risk. Once the spores enter the body, they're going to germinate once they find anaerobic tissue conditions. The incubation period can be from a couple days to up to a month. It's dependent on where the site of infection is relative to your central nervous system. We'll get into that in a bit. Typically, the symptoms on average are going to show up in about a week. So what does Clostridium tetani actually do to cause tetanus disease? Once it's in the body, these colonies of Clostridium tetani are going to produce the exotoxins tetanolysin and tetanospasmin. Tetanospasmin is highlighted here because this is the important one. That's the causative agent of tetanus disease. This is going to be the one doing the damage. It's going to enter the nerve cells surrounding the site of infection, these lower motor neurons, controlling your voluntary muscles. And once they get into these nerve cells, they're going to travel through the axons. So all the nerve cells are connected. So they're going to travel through these axons. They're going to reach the central nervous system. So either the spinal cord or the brainstem. And then once they're there, that's where the damage is going to be done. So as you can see up here, here's the tetanospasmin. It's in the central nervous system. And it's going to bind to your inhibitory nerve terminals for your skeletal muscles. It's going to block these inhibitory transmitters from getting through to send signals to those muscles, meaning these muscles are only going to receive excitatory transmitters, the transmitters telling them to contract. And that's what's going to cause the muscle contraction and spasms that we're going to see when we look at the signs and symptoms. So here you can see that hallmark trait of tetanus, which is the tightening of jaw muscles, the contraction of them, That's going to lead to difficulty swallowing, eating, breathing. This condition is known as lockjaw, and that's also another name for tetanus disease. It's another nickname, and it's because those inhibitory nerve terminals are being blocked by the tetanospasmin. These muscle cells are only receiving that excitatory neurotransmitter, and it's causing them to just contract all the time. This will happen throughout the body as well, throughout the skeletal muscle system, leading to spasms, stiffness and contraction throughout the body. It also will lead to headache, fever, sweating, stuff like that. And that's for generalized tetanus. Uncommonly, you'll see localized tetanus, which is just around the site of the infection. And then cephalic tetanus is resulting from an infection, or the site of infection being located in and or around the facial and cranial nerves, and it's going to result in paralysis of those nerves. So because tetanus causes these muscle contractions and spasms throughout the body, it can lead to some very serious health conditions. Here you can see in this image the contraction and the contortion of the body in response to these uncontrollable spasms. This can lead to broken bones because of those spasms. There can be a loss of breathing. People can develop pneumonia or blood clots in the lung. That's known as a pulmonary embolism. You can also see laryngospasm, which is vocal cord spasms. And then tetanus is fatal in around 11% of known cases, and that's with treatment. So without treatment, that number is much higher. Tetanus is a very fatal, very serious illness. There are treatments and vaccines for tetanus. It's a very serious medical condition. You will need to go to the hospital if you get it. And what they're going to try and do at the hospital, what they're going to try to help you is just trying to get rid of that Clostridium tetani, get it to stop producing the exotoxin, the tetanospasmin. That's going to be through wound cleaning, through antibiotics. There's also the human tetanus immunoglobulin. That's an IgG antibody specifically for tetanus. And that's going to provide passive protection since it's not the person's own antibodies. They're receiving it from someone else. And it's just going to provide that short-term protection because it's not the person's own antibodies. Typically, that'll be given to people who never had the tetanus vaccine or people who are immunocompromised and they can't produce those antibodies. The tetanus vaccine is the most effective way to promote or to prevent tetanus disease. Almost all the cases of tetanus in the U.S. are from unvaccinated individuals. Typically in the United States, people will receive the DTaP and the DT vaccine at first when they're a child, typically under 6 years old. So that'll be given to toddlers or very young children. And then later on, when you're between the ages of 11 and 12, you'll receive that Tdap vaccine. The Tdap is also for adults who never received a tetanus vaccination. I think it's important to note that the cost of the vaccine is significantly less expensive than treatment for tetanus patients. There was a study done that showed the effective cost of a vaccine per person, the development and transport of the vaccine is around $1 per person versus these extensive medical procedures that can cost up to hundreds of thousands of dollars. So around the world, tetanus infections have decreased rapidly recently, and that's because of the push to spread the vaccination effort around the globe. In around 25 years, we've seen the number of infections drop by about 500,000 cases. So there's definitely progress being made. However, there's still certain areas around the world where tetanus is still prevalent, still relevant in that society. There were just under 40,000 global tetanus deaths That's just in 2015, and typically we're going to see most of those infections occur in the Southeast Asia region and then also that sub-Saharan African region. These areas are at risk because they suffer from lack of widespread immunization. These underdeveloped countries that don't have access to the vaccine readily also have lack of access to adequate medical treatment if they do get tetanus, and that's what is leading them to have so many cases. For example, the US has about 30 cases per year, and that's primarily because we're at almost complete vaccination of the whole population. Another issue that we have to deal with tetanus specifically is neonatal tetanus, and that's when the baby and the mother after birth are infected with tetanus, and that's resulting from unclean delivery of the fetus, the infection of the umbilical cord, particularly, and that can be from unclean tools being used to cut that umbilical cord, and just unhygienic practices in general. This is such an issue because the mortality rate for newborns getting tetanus is extremely high, 80 to 100%. That's because their immune systems are just not ready to handle tetanus at that age, especially. There's a huge number of people, of women around the globe, who are still unvaccinated from tetanus, and that's leaving them at a very high risk for maternal and neonatal tetanus if they have children. Here you can see a map of where neonatal tetanus is happening, and it's in those regions where tetanus is prevalent, so Southeast Asia and Africa. You see a little in Central America as well. So what are we doing across the globe to help stop people from getting tetanus, especially neonatal tetanus? Around 30 years ago, there was a global push to eradicate neonatal tetanus. You can see that in those 30 years, the number of deaths from neonatal tetanus has decreased dramatically. Here's a diagram showing the countries that have eliminated neonatal tetanus since that global push. There are still a few countries left where it's still happening, and that's just because they don't have adequate vaccination cover. They don't have adequate medical care. And that's because the vaccine distribution, getting people immunized against tetanus, is the number one way to prevent tetanus infection. It's the best way to stop people from getting tetanus. Other good practices obviously include wounds, cleaning your wounds, being quick and thorough with it, and then also the hygienic birthing practices in the case of neonatal tetanus. But that number one best way to do it is the vaccine distribution. And that's why there's such a high push around the globe to get people vaccinated for tetanus. Particularly these booster shots, they're not as widely distributed, especially in the areas where the primary dose isn't even very well distributed. So that's another point of emphasis. So here are my references. I hope you enjoyed the talk. Thank you.